Hello everyone, my name is Ted Hartwell. I'm on the faculty at the Desert Research Institute, and I've taped a brief presentation that is an update to one I gave to the Native Waters on Arid Lands group back on June 19th about the status of tribal gaming and casino closings and reopenings in general, and wanted to provide an update to folks on where we are in that process right now. There's my contact information. If you have any questions or follow-ups you'd like to ask me, I'm pretty accessible, and you can reach me at any of those, that number or that email. Here's where we are as of July 11th. Basically, we have 150 casinos that are still closed across the country. The square icons represent the commercial casinos, and the round ones with the shield figure represent the tribal casinos. You can see they're kind of fairly evenly geographically spaced across the country. Here's another way to look at the closings and reopenings that have occurred through time, from the point in time that most casinos shut down right around the middle of March to when they began reopening in early May. And you can see as of July 10th, in this case, about 82% of tribal casinos and 87% of commercial casinos have reopened. The red line is the tribal properties. 430 of 524 are back open, and 409 of the 465 commercial properties have reopened. Here's another way to look at it. This figure is a little bit older. This is as of July 2nd, which is the most recent update from this particular site. The dark green representing those states where commercial is reopened, tribal on a case-by-case. The light green, tribal, is open on a case-by-case basis. The orange, commercial casinos are slated to reopen in less than 2 weeks. The yellow, tribals reopen on a case-by-case, with commercial closed for at least 2 more weeks or indefinitely. And red, which is Texas and Maine, commercial is closed for greater than 2 weeks or indefinite, and tribal is also closed as of July 2nd. I wanted to revisit some of the slides that I presented back on June 19th, I believe, and these show some of the slides that I presented, which were generated on June 18th. This is from Times site, and using the Johns Hopkins University Center for Systems Science and Engineering data, and what it shows is a rolling 7-day average of daily cases centered on the current date, and this is new daily cases per 100,000 people. And the red dots that I've added indicate when the first casino property opened up in each of these states. On the left, I've put the slides that I used back for my presentation on June 19th, and then to the right is the newly generated slide as of July 11th in this case. And in most cases, you can see within 2 to 3 weeks of the first property reopening in each state, there have been some pretty significant increases in activity. In the case of Idaho, this was the first tribal property to open, the Coeur d'Alene, back on May 1st, and things went along pretty well, actually, for well over a month before there were any issues. Coeur d'Alene were pretty careful about implementing required face coverings for both guests and employees, and limiting to 50% capacity, and they had pretty huge turnouts even with those limits, and experienced record table drops that opening weekend. So there is pent-up demand. There's definitely a willingness to show up even with everybody required to wear masks or face coverings, and I would argue that there will be more people who are comfortable and willing to show up if they know that everybody is required to wear masks than the other way around. But still, since mid-June, Idaho, you can see, has been experiencing a fairly significant uptick that did seem to start back around mid to late May. In Montana, similarly, an early May opening, and then by late May began to experience an increase in those new daily cases. One thing I want to mention is I don't mean to imply by any means that it's the casinos reopening that is causing the spike in cases 2 to 3 weeks out, but I think that reopening could be a good proxy for a general relaxation of attitudes, as well as a lessening of restrictions on reopenings of different types of commercial properties in general. So I think it's relevant in that sense. Here we have Washington State, earliest property again opened relatively early in May, and things were fine for a few weeks, and then there has been a near continuous increase in cases since then. South Dakota is a little bit unusual in that they opened the first property really right at the height of their new daily cases, and then experienced a fairly dramatic downturn and things looked good really all the way till early July, and then just over the last week or so they've started to experience an increase. If you'll remember, President Trump had his big rally over the 4th of July at Mount Rushmore, and while it's a little too early to tell if that was the most important event and what we see in the most recent increase, there were certainly thousands of people in close proximity, with very few of them wearing any face coverings of any kind. So kind of definitely a good potential for some type of spreading event there. Oklahoma opening its first property in the middle of May, and then again by late May to early June, a fairly significant increase in cases that has continued into July and shows no sign of stopping in terms of the increase in daily cases. North Dakota, like South Dakota, opened its first property right around the height of their cases and experienced a precipitous drop thereafter. But you'll notice since my presentation on June 19th, that trend has definitely turned around, and they are currently right back up to what was their previous peak in terms of new daily cases per 100,000 people. Arizona has certainly been a recent trouble spot for cases. Again, the first property opening in mid-May, and just a couple weeks later, a really significant upswing in cases. I know some of the larger cities, maybe Phoenix, has implemented a face covering requirement towards the end of June, and it looks like that may have helped a little bit there early in July, but that trend is still currently upward as of July 11th. There are some casino properties that reopened and then within a couple weeks had to close down again because of COVID-19 cases among staff and or in the community. And one thing to keep in mind is that it's very, very expensive simply to close down and then reopen a casino property. It can be into the hundreds of thousands of dollars, so you certainly don't want to find yourself in a cycle where you're reopening and then having to close down and reopen again. So you want to make sure that there is stability within your community in terms of cases probably before reopening. California, again, similarly, mid-May was the first opening of properties. They were already kind of on a slow upswing, but you'll notice kind of 3 weeks out, it takes a much more rapid increasing rise in daily cases and detections. And then finally, Nevada had been going along pretty well, flattening that curve, and been reasonably flat for a couple months before the first reopenings on June 4th. It looks like we were right at the beginning of an upward trend at that point. It's difficult to say, but certainly that trend did continue immediately after the casino reopenings. And then about 2 weeks out from the reopenings on June 4th, you'll notice a marked increase in the rate of positive new daily cases. To this particular graph, I wanted to add, and the green dot indicates when Governor Sisolak ordered mandatory face coverings for everyone in public places. And I want to point out that within 4 or 5 days after that order went into effect, there does seem to have been a flattening of the new daily cases since then. So very positive in terms of, I think, again, reinforcing that idea that face coverings are possibly the best way that all of us can help to mitigate the spread of COVID-19, certainly when we're out in public places. But I don't want to imply that just because it's flattened it, that we're out of the woods. We still have a very high daily rate of new detections. We have a high positivity rate of tests in Nevada. It's up a little over 13% right now. I believe the World Health Organization wants to see that down under 5%, is kind of a target number for the positivity, a positive response for testing. I have included a couple more graphs here to show our current hospitalizations since mid to late June have gone up dramatically, as has our rolling average of new deaths as a result of COVID-19. We're almost as high as as our peak way back at the end of April. But I do want folks to remember that a lot of this data kind of lags behind. So, you'll often have people who go out and get tested, they don't feel well, which adds to the, of course, increase in positive cases once they get their tests back, and that the hospitalizations will tend to lag a little bit behind those positive tests, and then any deaths from COVID-19 will lag further 2 to 3 weeks out, often from the hospitalizations associated with those tests. So you'll notice in the current hospitalizations, at least over the last few days, 9th, 10th, and 11th, we have had a decrease in numbers. Hopefully that will continue, but again, we're not close to being out of the woods, and we all need to do what we can to help mitigate the spread of COVID-19 for sure. One other thing I wanted to mention, I had some questions about contact tracing. I know some of you probably were able to catch the training this past weekend. If not, I believe that Indian Health Services were going to make that recording available within a few days on training for contact tracing. One thing that I did find in researching contact tracing with regards to casinos, there were a couple of properties up in Canada and even some retailers that had taken the step of using player loyalty cards to assist with that. And certainly with the notification process of individuals who might have been exposed by someone else. There were some pushback regarding privacy concerns in that area. I did come across one reference. I know Isleta Casino outside of Albuquerque, as one of their reopening measures, required all returning players to register for a new player loyalty card. They didn't expressly say it in the language that I read, but there certainly is certainly is the potential to use player loyalty cards. In the case an employee tests positive, for example, for COVID-19, you have people's history basically of how long they sat where at various machines or table based on their loyalty card use, and you're able to inform those individuals who may have been in proximity to that employee who has tested positive fairly quickly. And if patrons choose to self-report that they've tested positive, of course you can go through the same exercise in letting all of those individuals who may have come in contact with another patron who tested positive for any length of time that they might have been exposed and advisable to get testing. Of course, they could use all of this for contact tracing, but again, there are those privacy issues that are of concern, and unless you inform patrons that they could be used in that way, I think it's a little bit of a slippery slope. That's all I have now. Excuse me. Oh. That's all I have now. I look forward to seeing everybody at the regular meeting next Friday.